Daniel Cox is a professor of psychiatric and internal medicine at the University of Virginia and a type 2 diabetic.
After working in diabetes for about 35 years and telling my wife, last thing I ever want to do is get diabetes, I found myself waking up in the middle of the night, having to go to the bathroom, being very thirsty all the time, and I realized, oh damn, I got diabetes, you know.
Over the past 7 years since his diagnosis, Cox has been using glucose blood monitoring to keep his diabetes monitored and subsequently under control. In 2017, he received a $2.7 million grant from the National Institutes of Health to test his strategy in a clinical trial setting.
Well, this particular trial is to evaluate whether or not there is an effective alternative to the conventional treatment. Can patients with type 1, type 2 diabetes have a new option, another option, and potentially a more effective option than what's currently available, which is weight loss?
This new study places a de-emphasis on weight loss or medication, instead focusing on food awareness and post-meal exercise.
So we don't just tell them, don't eat these foods. We say, eat these foods, measure your blood glucose before and after, and see what they do to your body. And then you make the decision, what do you want? And some people may make the decision, yeah, I still want to have oatmeal. Well, that's their decision. But at least they're informed how their body responds.
Cox and UVA colleague Dr. Anthony McCall are planning to continue with a second clinical trial before embarking on an even greater 200-person study to explore variations on his method. Preliminary results are promising.